Good afternoon, everyone. Thank you all for joining today. My name is Rosa Staltieri, and I'm the Knowledge Translation Manager with CanCOVID and also the Speaker Series moderator. It is a great pleasure on behalf of the CanCOVID team to welcome Dr. J Hoffman, who will be presenting the United Nations Research Roadmap for the COVID-19 recovery, leveraging the power of science for a more equitable and sustainable future. So just a little background on Dr. Hoffman. He is the scientific director for CIHR's Institute for Population and Public Health, invited by the United Nations Deputy Secretary General. Dr. Hoffman led a 10-week participatory process to develop the United Nations Research Roadmap that outlines how science and scientific collaboration can spur an equitable global socio-economic recovery. Today, we have the pleasure to learn more about the roadmap and how researchers, research funders, civil society organizations, and governments can use it to guide their work. So before I hand over the floor to Dr. Hoffman, there are just a few items I'd like to note. As most of us know, we welcome you to keep your camera on. And if you please, we ask you to ensure that your microphones are on mute just for the presentation. And then for the 10-minute question and answer period, we welcome you to ask your question either live or through the chat box. And another note is that our speaker series events are all posted on YouTube, and this recording will be available in about 2 to 3 days on average. So Dr. Hoffman, the floor is all yours.
Great. A big thank you to CanCOVID for inviting me to give this presentation. This is something that I was really quite honored to have the opportunity to do, to be invited by the UN Deputy Secretary General and do this work in my role at the Canadian Institutes of Health Research. I think we all have experienced this firsthand, that we are living through extraordinary times. I think we all use that term quite a lot. But what it highlights is that the power of science is to get through these extraordinary times. What we have seen, I think, over this last year has been a heroic effort to develop diagnostics, to develop new vaccines, to develop new social interventions to make sure that we can get through this extraordinary event as best as possible. But we also know that the consequences of this pandemic are vast. This pandemic has been a grand revealer of a lot of problems previously existed before this pandemic, but which have now been revealed and which now hopefully are being increasingly viewed as unacceptable and in need of urgent action. And so this research roadmap that the United Nations developed, this was really an attempt to think about not the immediate research needs of today in order to get through the pandemic, but instead making sure that when we get through this terrible experience that we've all gone through together around the world, ideally, how do we emerge better from it? How do we get a future? What kind of research do we need to be starting to do today, funding today, undertaking today? What kind of partnerships need to be built so that we can leverage that new knowledge for a better, more equitable, resilient, sustainable future thereafter? So today, I'm just going to briefly walk through about the UN Research Roadmap for the COVID-19 recovery, the process we followed to develop it, where we landed. This document was published in November. A French version of it will be published this month, and so that will be available as well. And I'd be happy to take questions at the end. So the starting point for this UN Research Roadmap for the COVID-19 recovery was very much reflecting on the fact, as I mentioned, that this pandemic has had enormous social consequences. And I think in many respects, we're all going to remember 2020 and of course 2021, we're still in it, from the personal experience that we've all had. But we will also likely remember it as the year when that very quick pace of human progress that we had been marching along over these last few decades suddenly took a step back, a very big step back. For example, last year, estimated 71 million people were pushed into extreme poverty. At some points, 90% of kids around the world had to be out of school because of the pandemic. In some countries, domestic violence was reported as increasing by 30%, up to 30%. And 60% of countries reported prison overcrowding, which of course would lead to increased risk of spreading COVID-19, as well as all the other consequences that flow from it. In other words, what I'm highlighting here on this slide is that we have long been making progress across various indicators of human development, including slow progress, too slow progress, but progress on the Sustainable Development Goals that were agreed to in 2015. But what we have seen in this year is quite a big step back across all these indicators, very much threatening the kind of future that the world has articulated for itself as where we want to get to. One of the immediate reactions to this was in April of 2020, when the full social costs of this pandemic were increasingly being realized. The United Nations developed a framework for the immediate socio-economic response to COVID-19. This was the UN's attempt to try to bring an entire one UN system to respond to the very unique and rather dire circumstances that this pandemic posed in many countries around the world. In their framework, they articulated 5 pillars where the United Nations committed to taking action, but also where the United Nations invited member states, civil society organizations, researchers, research funders to try to take action as well. First one on health systems and services, second on social protection and basic services, third on economic response and recovery, fourth on macroeconomic response and multilateral collaboration, and fifth on social cohesion and community resilience. With that though, there was thinking that, okay, there's an action plan for what the UN can do, and there's a clear call for others to join the United Nations in that effort. The UN Deputy Secretary General thought that it would be valuable to have as a complementary document a very clear research roadmap that was able to turn what will likely be a massive recovery effort, unlike any we've ever seen before, into ideally a rapid learning recovery effort, one whereby national and international strategies would be able to be evaluated and learning in real time, so that any interventions done later in the recovery period can actually benefit from learnings that have happened earlier in the recovery period. And indeed, those early efforts, if we can catalyze research early enough, ideally, they can then be informed by research that during the pandemic period, in other words, right now. And so the objectives of this roadmap was, how do we transform the UN socioeconomic recovery framework into a rapid learning initiative? Number one, it's about ensuring the COVID-19 recovery is informed by the best available research evidence. Second, supporting a learning from early response efforts to inform later response efforts. Third, bringing renewed focus to those systemic issues highlighted by the COVID-19 pandemic, and increasing focus on marginalized populations who have been most affected by this crisis. Fourth, enabling international scientific collaboration through a unifying global framework. And so with that, what we did is I was given 10 weeks. So the UN Deputy Secretary General said that this was urgent, and it was. She asked, could we deliver in 10 weeks? And we did. And so with colleagues of mine at the Canadian Institutes of Health Research, working with partners across Government of Canada and other organizations, including the Social Sciences and Humanities Research Council, Natural Sciences and Engineering Research Council, Canada Foundation for Innovation, with Global Affairs, with the Public Health Agency of Canada, Health Canada, IDRC, Grand Challenges Canada, we crafted a process that we tried to be as inclusive as possible, reflecting though that we had 10 weeks. And so we did this process in 5 parallel streams. The first is we convened 5 steering groups. These were composed of leaders from research funding agencies representing 25 countries in all regions of the world. Second, we had a specific process to engage experts from around the world that included written submissions that we solicited from various organizations. We invited, we hosted a couple, 2 virtual consultations focused particularly on trying to elevate youth voices in those countries that were not represented in the other various processes. And we did key informant interviews. And then third, we did rapid scoping reviews, which was really all about trying to find out the state of the art across the different areas of the UN socioeconomic response framework in order to then craft an appropriate research prioritization to be the focus. And so ultimately, at the end of the day, in this research roadmap, what we do is we articulate an opportunity. And this roadmap is really all about highlighting that this unprecedented time that we're about to find ourselves in once we get through this pandemic will be a time of great change. But how do we make sure that that change doesn't get us back to the way things were, which for many people and many parts of society were not acceptable, and we're not actually very good, and we're not allow progress at a pace that would let us achieve the Sustainable Development Goals by their 2030 deadline. Instead, how do we use this shock that we've all experienced together as a catalyst for more transformative changes that would bring about a much better future, a more equitable future, more resilience, and a more sustainable future? And essentially what we do is we highlight a choice that all societies around the world are going to face some months from now when we're through this pandemic. And the choice is going to be between business as usual, which would be going back to the way things were, or a choice for transformative change. Now, the advantage of business as usual is that we actually don't need new knowledge. All it is just going back to the way it was. The unfortunate thing, though, is if we go back to the way things were, we weren't on track to achieve the kind of goals that we had set for ourselves as a world. And so instead, it's clear the advantage of a transformative change is to get to a better future. But then the challenges with the transformative change is we actually don't know how to get there. Because if we knew how to get there, we would have been doing it before. So what it highlights is the vital role that science, and in all of its shapes and sizes and forms, is going to need to play in order to achieve a more equitable, resilient, and sustainable future through transformative change. Because without science, without that research that's going to enable it, the status quo leads us back to the way things were, which for many people, I hope you'll agree, was unacceptable. The final roadmap document, which has been published and is available, it articulates in the end 25 research priorities across the 5 pillars. Essentially, there's 5 priorities for each of those 5 pillars I previously mentioned. We provide a framework for trying to understand both the challenges as well as the opportunities that lie ahead when it comes to COVID-19 recovery. And we highlight 5 science strategies that we think will be necessary to ensure that there's strong scientific systems within each society in order to be able to leverage the power of science for a better recovery. So moving first to the 25 research priorities, I won't go through them all, but I will emphasize that when you come up with 25 priorities, when you have 5 steering groups and it's all done in 10 weeks, 270 experts, 5 scoping reviews, it can lead to, there are 25 very unique, I think quite special areas, all of which are prioritized and needing of attention. What we did though was, what we found was that as all of this work was happening, yes, we were talking about different priorities in different areas, but all of the were really ultimately about, and all of the conversations that we had were really ultimately about one question, which was, as we go through this recovery that is going to be coming, how can we make sure that any efforts that we do achieve co-benefits for equity, for resilience, and for sustainability? In other words, how do we not just repair or restore, but how do we make sure that we restore better in a more equitable way, more resilient way, more sustainable? And the idea then is it's really about that a co-benefits model that then leads to thinking about, okay, how do you design health systems that are more responsive to the kind of 21st century threats that we now face? Or when it comes to social protections, how do we make sure that they're available to everyone, not just those who have a job and might have sick leave through that job, but how do we make sure that everyone has access to benefits? How do we make sure that those benefits are able to when other systems are challenged in light of any kind of shock to it? When it comes to economic recovery programs, how do we make sure that a recovery is not only good for the economy, but also good for the environment? And then when it comes to multilateral collaboration, how do we make sure that we're better prepared for a future outbreak, a future emergency of any kind, to make sure that the lessons learned during this pandemic are ones that don't get relearned next time, but actually we can, those challenges don't present themselves next time because we figured out how to do it better. And then on social cohesion, how do we build on the strength of communities and address the underlying root causes and drivers of marginalization, which then leads to disparities and inequities. Ultimately, though, the reason then we talk about co-benefits in this way is because what this UN research roadmap is driving towards is how do we achieve a quadruple bottom line from our COVID-19 recovery efforts. And as you can see in this slide, what we're saying is that solutions that achieve direct benefits, those are great, but even better would be solutions that achieve one co-benefit, even better, two co-benefits, even three, even better, all three of these co-benefits. But to get this, we don't exactly know what all these solutions have to look like, how they need to be different in different contexts in which they might be implemented, how to turn great solutions into highly politically feasible solutions, political wins that are appropriate for an economic development and appropriate for what the population desires and where each society wants to go. All of that will depend on rigorous research done now by researchers to prepare for this, as well as the efforts of researchers early in the efforts to evaluate how things are going in order to inform later stages of this recovery. And ultimately, one thing that we research roadmap is that we need all three of these co-benefits. It's not enough if we have, for example, equity co-benefits or even sustainability co-benefits. If we don't build systems that are resilient to future shocks, then we're just going to find ourselves exactly back to where we're currently finding ourselves, which now today, COVID-19 being not just a pandemic of the virus that causes this disease, but also a pandemic of inequities and social consequences. With that, let me just shift to then the third part of the research roadmap, which was identifying science strategies in order to, that we argued that all countries, organizations, companies, everyone should be thinking about in order to ensure that we can actually leverage the power that new knowledge can have in order to spur change. And so the five that are these. The first is data. Data, it's everything. It's without it, so we are limited, but also with it, it's not just the data itself, it's the broader data infrastructure. It's around the data, but it's about the organizations that are needed to make use of it. It's about the policies, the processes, the technology, the oversights, the accountability mechanisms. But even with lots of data, and that's a clear starting point, the roadmap also highlights the importance of implementation science. This, of course, is an area that has been very much championed by many colleagues of mine in Canada, as well as through the Canadian Institutes of Health Research. It's an area that needs continued growth because increasingly we are seeing that point where we know about technical solutions to various challenges, but we have not done the corresponding research about how do we actually fully implement these technologies, how do we adapt technologies, or what kind of specifications are needed for new technologies in order to ensure that we can fully benefit from them in various different contexts. Third, we need to develop rapid learning systems. This is really all about ensuring that we don't only learn after a 10-year big effort has been initiated and fully delivered, but rather we can learn in shorter bits over time and feed that learning back into rapid adjustments to improve continuously over time. Fourth, of course, knowledge mobilization, efforts designed to promote and make use of research evidence. And fifth, we need, in all societies, thinking about a science of science. And by that, what I mean is we not only have to bring a scientific lens to the policies and practices and programs that are going to help us get through a COVID-19 recovery, we need to put a scientific lens on how we're actually leveraging science. What kind of funding programs are going to work? How can research cultures influence impact for what we're trying to achieve? How can different parts of society all come together in a common knowledge agenda? These kind of questions I think will be critical. And then just for a second last slide, in terms of actions as next steps, the hope is that researchers will be able to make use of these 25 research priorities to either inspire, to point to in any work that they plan to do or applications and things. We hope research funding agencies will pick up these priorities and identify targeted calls where these kind of research can be funded. And we hope governments and civil society organizations ask for this kind of research to inform their recovery efforts, support it, and indeed try to institutionalize the use of research in decision making. Just then as a final slide, one of the next steps from this whole process, since it was published in November 2020, is we are trying to get the word out there, we're trying to build partnerships, and indeed then get ready to track progress. So one thing that is coming up I'm quite excited about is that the Canadian Institutes of Health Research will be co-hosting with the UN Office for Partnerships an open dialogue with the UN Deputy Secretary General, and we'll be inviting the heads of international research funding agencies all about how do we leverage science for development in the context of COVID-19. We also have various plans to disseminate the roadmap through UN agencies, and very much big thanks to the International Science Council for their support. Developing partnerships between UN country offices and regional offices and funding agencies as desired and appropriate. Exploring new mechanisms for coordinating between UN agencies and research funders. And finally, through the efforts of GLOPIDAR and the UK CRD, we have created a funding tracker in order to make sure that we're able to track over time what kind of investments have been made across these 25 priority areas in order to see where funding has gone, as well as to be used as an informative tool for funders to see which research questions have not yet been answered. So with that, I'll just thank CanCOVID again and thank all of you for being here. I look forward to the Q&A.
Thank you so much, Dr. Hoffman. And I will give this opportunity for our guests to ask any questions at this moment. You can also ask your question live or through the chat box, whatever means you'd like. Okay, so I will maybe ask the first question. So thanks again, Dr. Really very and also very important for moving forward with our roadmap. Now, I'm wondering if any of this if this is going to be sort of used and contextualized to other countries, and whether or not that was sort of thought about when you guys were doing this roadmap.
Yeah, so it's a great question. This roadmap is not a roadmap for any one country. It's intended to be a roadmap for the world. And so one thing that we recognize is that this roadmap is not and cannot be just copied and pasted for any one jurisdiction. In fact, one of the things that, one of the benefits of that a lot of the steering committees in this project were involving research funding agencies is that a lot of them are embedded within research funding ecosystems within their country. So based in Canada, I mean, the Institutes of Health Research, we're one funder. We're the federal government's health research funding agency. But of course, there's a much bigger ecosystem in Canada. And so to take the UN research roadmap and bring it home to Canada, and in my context, that requires further discussions with Canadian research, with Canadian researchers and other partners and agencies, and that process is happening. But that process that's happening in Canada, similarly, it's happening in many other countries. And it's actually been, I guess because of my role in leading this effort, it's been really quite an honor actually to see when other countries have been approaching me about advice and such about bringing the roadmap home to their own cultural, political, economic, social context. And what's been really great is that what we've seen uptake in some of the richest countries in the world. We've seen uptake in some of the poorest countries of the world. and everything in the middle. So it was very much designed thinking in mind of what are some of the commonalities. And just to emphasize, because your question gave me the opportunity to do so, I was very surprised throughout the development process how common these challenges are across income economy. And I think very often we accidentally divide the world into different groups. And I think for some reasons that makes sense. But what we see here is that we're all going through a rather terrible experience right now. And we are surprisingly faced with a lot of the same challenges for which research can help us get through and recover better from.
Thank you so much. And we have a few more questions in the chat box. So the first one is from Lauren Jewett. So the question is, can you talk about what has evolved most since publishing the document regarding COVID-19 and the socio-economic knowledge?
Yeah, that's a great question. Thanks, Lauren, for it. It's interesting, when we were initially doing this work, so I was invited, it was in June that I was invited to do this. And so basically we did this project over the summer. The summer context was very different than the context in which we find ourselves today. And so I think what I think that highlights is that part of our challenge was not to think about what are the needs of governments today. The thinking, or what we tried to do is, okay, what are the needs of government in fall 2021? That's what our thinking was. We were trying to predict more than a year in advance of what those needs would be. And it wasn't easy, of course, because we're all looking into our crystal balls and trying to figure it out. But I think that what we have seen is quite a few of those areas have been a little prescient, in the sense that we have, well, many places in the world have seen a very steep and maybe a rather scary second wave. In my own province of Ontario, in 24 hours, be a province-wide lockdown. We are in a new world in which a lot of the issues that were emphasized in this research roadmap are actually coming to the fore. It's the inequities, it's environmental sustainability, it's civil liberties, it's a digital divide, right? Because all of these efforts have very much exacerbated those existing problems, but have also highlighted the extent to which the ways that we are working to get through this pandemic are having differential effects. And therefore we need to be prepared for that. So yeah, I would just say the key difference is that there's actually much more receptive milieu in which to think about these things, because many of us are seeing it and living some of those social dynamics in ways that in the summer were not actually top of mind for many people. That was our job. We were asked to try to be as prescient as we could be. I'm pretty proud of the work that we did.
Thanks so much. So the second question we have is from Sanjay. And this was sent to me privately, so I'll read it out to you. With reference to implementation science, are there any initiatives that CIHR is spearheading to build capacity for new investigators in Canada?
Yeah, so what I can say is that training is definitely a top of mind priority for all leaders at CIHR. It's something that is a personal passion of our president, Mike Strong. As part of that effort, it's clear that the whole agency is taking a relook at all of its existing programs with respect to building capacity, with the hope that we'll be able to support even more robust lifespan or career trajectory supports that would enable people to see themselves in the system across all different stages. Implementation science specifically is one of those areas that is discussed quite a lot. It was an area that was in many respects emphasized through our strategy on patient-oriented research, but also it's very much the center point of all of CIHR's, or most of CIHR's major initiatives on global health. And I would suspect that there will be continued excitement around building up capacity in the space.
So we have about a minute left here, so we'll try to get through as much questions as possible. So the next one is from Alice, and she asks, what is the best route for submitting solutions for supporting global roadmap?
Yeah, so I think that the roadmap it's not intended to be prescriptive, telling anyone what to do. It's about trying to identify opportunities. We hope that everyone will be able to be either inspired by it or be able to pick it up or act upon it in some way. For some people, that's going to be a grant application to their national, provincial, or local funding agencies. For others, it's going to be trying to make use of their existing research programs and maybe pivoting or adding on or encouraging a student to do work in a certain area. For others, it might be about trying to link up with policymakers who might also be thinking about these issues and trying to think through what can existing knowledge that's been either published or that's tacit knowledge organized within civil society or companies, how do we then make use of that? And so I would say that there's no single route, but the hope is that there's many different routes that will be possible to take action. Oh, I do see the next question in the chat is from, I guess, my boss's boss. So I think we'll take that one.
Okay, fine. So this last question is, how might the science of science funding articulate with the new UN's new research roadmap? So
yeah, so Jeannie Chevalier, who's the chair of CIHR's Governing Council, a big thank you, Jeannie, for the question. You know, I think increasingly research funding agencies need to get serious about not just expecting others to do research and not expecting other policymakers to make use of research, but for research funding agents to be actually part of that in thinking about, okay, what research can inform the policies and actions of research funding agencies. It's a common challenge. It's one that the roadmap was highlighted through the roadmap development process, that if we're asking for science there, we need to be more reflective about it at home among those who are responsible for research funding and other research system supports. And so I think the good news is the conversation is starting, certainly at CIHR, among my colleagues, other scientific directors, we talk about this quite a lot. And the hope would be that research funding agencies like CIHR, but all of them are able to seize this opportunity represented by the COVID-19 recovery to get even more serious about figuring out and bringing a scientific lens to bear on how science needs to be part of future solutions to the myriad of problems we face.
okay, thanks again. So we're about 2 minutes over 4:30, so we're gonna close. But on behalf of the CanCOVID team and network, we thank you so much, Dr. Hoffman, for your time to present to us on the global roadmap. And just quick notes for everybody. Next week, we'll have another speaker series, which will be on, which is titled the Canadian Institute for Health Information's COVID-19 Scan and Timeline with Applications for Modeling by Doctors Christina Kately and Olga Krylova, sorry. And also for many of you who joined a little bit late or who may have not been able to see the slides, we will be posting this on YouTube in about 2 to 3 days, so you'll be able to revisit the talk then. So thanks everyone and have a great evening.